Good morning, everyone. Some updates for you since we had some significant meetings yesterday. We went before the City Council with an updated data model, as well as information about case counts and where we're at. We are experiencing right now what is positive information in terms of our 14-day trajectory of our case counts. The information that we share at this briefing many times, each week over the last few weeks is information that we also shared with the council, and that is that we're on a 14-day decreasing trajectory of our cases of COVID in Sioux Falls and the Sioux Falls area. We also know that based on modeling that we have done in our for our community, we've updated that modeling several times. That modeling is based on information that we have at the time that's available to us to try and predict out where we might be with our hospitalization rates. And based on the most recent modeling, we know that we are also in a place where the demand for hospitalizations may be is far below the capacity of our health systems locally to be able to handle those cases of COVID. And so that's good news, and as a result of that, it was recommended to repeal the no mingling ordinance or the most recent ordinance that was in place setting regulation for our community. In its place, we did then, there was an approval and an adoption of a resolution, which it really encourages our public to continue to be mindful of how COVID is still very, very present in our community, how the risk is still there, especially for our vulnerable populations, and how we all need to do our part right now, absent regulation, because that regulation was very much aimed towards how are we going to, as a community, ensure we have the health care that we need. And so policy of the City Council was really necessary for a period of time. Now that we know we have capacity for all of us, if we should get sick with COVID, which I hope we don't, I wouldn't want anybody to become sick and need to be hospitalized with COVID. But if we do, we have, the hospitals are ready to care for us and have the capacity to do so. On the side of public health, and what we all need to do as a community, is what was formed in that resolution, or what became the body of that resolution. And it really encourages us to continue to use really good respiratory hygiene, to cover your coughs and sneezes, to adhere to social distancing at least 6 feet apart. It's really encouraging all of us to wear our cloth face coverings whenever possible when you're out in public, you're out of your home and you're out in public and you're around other people, to please consider wearing a cloth face covering. Vulnerable populations is still that group of people in our community are vulnerable populations, people over age 65 or folks in our community that have underlying health conditions and could be really at much more high risk of getting very sick if they contract COVID. Those are individuals we want to continue to be really paying attention to their social distancing, to making sure that they are taking actions to reduce their risk of COVID. We also are encouraging through that resolution what we've been saying all along, and that is, if you are sick, stay home. This is not the time to be trying to open up any level of risk in our community, and so continue to stay home if you're sick. We also want you to be mindful of your mental health and your emotional health at this time, and so we're recognizing the fact that people need to get out, they need to get out in the sunshine, need to get out for walks, need to be able to do those things that really get them, in that good mental health space, and so that's something that we encourage as well. And lastly, we're encouraging businesses to really use good judgment at this time and to make sure that they are following closely the guidance that's out there through the Centers for Disease Control, through our state, South Dakota Department of Health, and making sure that they are following those practices to ensure that social distancing as well as other hygiene practices are being followed. It's really important for them right now to make sure their staff are safe and their staff are well protected, as well as protecting their patrons. And so those are encouraged guidance that they need to be following right now. So those are the activities or the actions that were taken by the City Council yesterday. That resolution was a regulation that our Board of Health passed as well. And so that is something that the Board of Health is strongly encouraging as well. So we'll continue, our business community as they continue to be, working towards following that guidance. We still have our SOAR team that is actively working with businesses in the community and helping to provide some additional technical assistance. And so we really encourage the use of SOAR resources right now as well. So we'll continue to update the City Council and the public through a number of platforms that we'll engage in going forward. So we'll be doing council presentations regularly. We'll be continuing to show daily updates on our dashboard on siouxfalls.org/COVID-19. We're going to have active social media updates, and then weekly data will be sent out to the media every week through a news release and a weekly email. If we start seeing changes and we start seeing things that we need to be making sure the public's aware of, we will continue to do media briefings as they are necessary. And so they won't be necessarily in a regularly scheduled time frame, but we will be very much coming to this briefing and updating the public as is necessary. So with that, I'll take any questions.
You said you're confident in capacity of, I guess, hospital beds if something happens. Is that just one part of a fallback if the cases start to shoot upwards?
So the question is the hospital capacity just one of the fallback
Overall
measures?
Fallback plan, just in case the numbers start to spike.
Well, certainly that, I've been talking about this in two different perspectives to answer your question about what I think was your question. First off, there's that policy side, and that's what the City Council was really charged with, and that's in their domain, if you will, is setting that policy for the city. And that was really based on making sure we have that capacity to be able to have people be served if they get sick and need to be hospitalized with COVID. So that was that on that policy side. And public policy. And then there's on the public health side, and that's all the other measures that we'll continue to be doing. We have to educate the public. We want to make sure that people are aware of what's happening in our community and what they can do to protect themselves, and make sure that we're providing the technical assistance through avenues like SOAR, and make sure that we are monitoring daily where we're at with this, and working closely with our partners to make sure that we're mitigating the spread as much as possible in our community.